what happens every sort of 5 or 10 years, the World Cancer Research Fund produce a report on what they've gathered up all the information in the last 5 years or 10 years of research, and they put together some dietary recommendations. And these are the latest from the third report that came out in 2018. So the first one is to be at a healthy weight. So that's usually a body mass index between 18.5 and 25. So that's your weight in kilograms over your height in meters squared. So it's usually a range, and that's what they try and aim for. The second one is to be physically active. So this means trying to be active, whatever you're doing, it's trying to do more. So looking at 45 to 60 minutes of activity every day. You think back to the time when you went to school and how much activity you were doing, riding bicycles, walking, playing sport. And this is the activity they want to get up to. And they want to try and decrease your screen time as well, the amount of time you spend on computers or televisions. The biggest one is eat a diet rich in whole grains, vegetables, fruits, and legumes. So this is where you eat the rainbow. Every night you've got to have all the range of different colors, vegetables. And then you've got to have 2 or 3 serves of fruit. You need to have some legumes every day and whole grain foods, up to 30 grams of fiber every day. Every whole grain, wholemeal bread, brown rice, wholemeal pasta, and it's very important. Then the other ones are wrapped around limiting the fast foods, limiting the red meat. That's about 300 grams a week. So you have chicken and fish instead, or legumes. Limit your sugar sweetened drinks, limit alcohol, and then the recommendation is you don't need to have supplements for cancer prevention. So they're the general guidelines that the World Cancer Research Fund have put out that we need to follow every day. I won't go into that. Just with diet and bladder cancer, the report has a particular report on each of the different cancers in different parts of the body, and they've reported on the diet and the involvement in bladder cancer. So they're saying decreased risk if you have lots of vegetables and fruit, tea, and physical activity are really important to decrease. So they're the only things that they've come up with which are related to diet and bladder cancer. And then increasing risk, they haven't found any link with alcohol. It's usually confounded by smoking. Arsenic as a contamination in water. I know we don't normally have arsenic in water, but it's usually a contamination from mining or agriculture. And then smoking is a big risk as well. So that's a summary of the latest information on diet and bladder cancer and diet and cancer. I'm not going to hand over to Alana and Celeste, and they're going to go through the other topics you wanted to discuss today.
Thank you so much, Peter, for that introduction. I look forward to the next part of the talk.
So I guess in relation to specifically the role of the dietitian in your I guess your treatment, your nutritional needs change throughout each stage of your life, depending on what's going on. So for example, someone that has cancer and is undergoing treatment, their body requires more nutrients than the average person. So that includes energy and protein. So therefore it can be difficult for some people to get that extra nutrition in, which is where a dietitian can come in to provide individualized advice to help ensure you're getting adequate nutrition. And this can be very different depending on the patient. Like Peter said, it's about being in a healthy weight range. So obviously the advice is going to be completely different for someone who is underweight versus someone who may be overweight. We also focus on managing possible side effects from your treatment to help ensure that you're getting enough nutrition and adjusting to your specific circumstances and lifestyles. If you have any other comorbidities, any other diseases, taking that into consideration. And I guess most importantly, using that latest evidence-based research to formulate all our recommendations and advice. So I'm going to go into the side effects from treatment. On a note, I'm not going to talk too much about immunotherapy, other than that it is a form of chemotherapy that uses your own immune system to fight the cancer. It's generally less toxic than your general chemotherapy. So Therefore, it doesn't generally have as many side effects compared to your normal chemotherapy drugs, though some of the side effects that you can get are similar to what I'm going to discuss. So with nausea and vomiting, it's the most common side effect from chemotherapy. That's not to say that because you're having chemotherapy, you will get nauseous or vomit. It depends completely on the type of chemotherapy drugs and the doses of those drugs as well. So antiemetics are also known as anti-nausea medications. So they can be really helpful to manage your nausea. And obviously that can also help make sure that you're getting enough nutrition in. Some common medications are Stemetil, Maxolon, ondansetron, and taking these, if you're taking them regularly and you find that your nausea is not well controlled, it's definitely something that you should discuss with your doctor as well. They work best 20 to 30 minutes prior to a meal so that it helps settle your stomach so that you can then get enough nutrition in at that next meal. Some other helpful tips to combat nausea is eating your largest meal when you feel the best during the day, and that's different for everyone. Some people feel more nauseous in the day, some at nighttime, so just picking that time of day that works best for you. We generally advise 6 smaller meals in the day rather than trying to get all your nutrition in at just breakfast, lunch and dinner. Not skipping any meals. This can actually make your nausea worse. Having an empty stomach tends to increase nausea. Cold foods, sometimes smells can trigger some nausea. So hot foods tend to have more of a smell than cold foods. So focusing on cold foods can be beneficial. Avoiding high fat foods. These tend to sit in your stomach for a lot longer because they delay digestion, which can also make you feel more nauseous. And then having things like flat, dry ginger ale or lemonade, which is probably something you did maybe as a kid after vomiting, can also help settle that nausea as well. It is important that if you are vomiting and maybe multiple times a day, that you are getting adequate hydration and preventing any dehydration. So making sure that your fluid intake is adequate during that time. So another side effect is diarrhea. So we quite often hear patients say that they have diarrhea, but it's not always correlated to the actual definition of diarrhea. So the WHO defines diarrhea as passing 3 or more loose or liquid stools per day. Now, for some people, that's to go 3 times a day is normal. So for those people, it's about if they're going more frequently than that. The concerns with diarrhea, again, like vomiting, is that you may become dehydrated. Some other side effects are lack of energy and poor nutrition because things are traveling through your gut faster, not as much nutrients and water are absorbed. If you are having diarrhea, it's definitely important to discuss with your doctor to see if there's some medication that can help alleviate your symptoms and adequate fluid. Things like hydrolyte or rehydration solutions can be used if you're having quite a large number of bowel motions a day. This just helps the fluid get better absorbed through the gut. Also avoiding some problem foods. So these are things like spicy foods, high fiber foods, which include cereals, breads, nuts, legumes, and large quantities of raw fruits and vegetables. And if you're having quite a few bowel motions, people can sometimes become temporarily lactose intolerant. So minimizing those foods can be helpful. Now, this is just recommendation while you're having diarrhea. So that doesn't mean you need to cut out these foods long term. Once the diarrhea resolves, it's usually no problem to re-include these foods that you would normally be eating. Another common side effect is taste or smell changes. The most important thing to remember is that if you do experience this side effect, that it does subside and it is not permanent. and it usually goes away about 2 months post your chemo treatment. So there's a few different strategies to help make sure that you're getting enough food in, and trying to make it taste as good as we can. So if foods are tasting bland, adjusting your seasoning. So salt, pepper, spices, herbs, that type of thing, to elevate that flavor so that hopefully you'll be able to taste it. Experimenting with lots of different foods. If you're having difficulty swallowing or chewing because you've got a dry mouth, making sure you're having enough fluid intake. There are some products that can help replace or stimulate your saliva, which you can discuss with your doctor, or choosing more moist, soft foods, so that that food's already got that inherent fluid in it, and that can just help if you've got a dry mouth. So like I said before with the smells, colder foods, if possible, maybe you aren't the one preparing food and maybe you're not in the kitchen area while food's being prepared, when that smell's kind of the strongest. Because the aversion to smell can actually have long-lasting effects post treatment, and that's more psychological with the associations of smells and memories, which are quite strong. Another side effect from some chemotherapy is your increased risk to infection. So doctors quite often will explain that your immune system may be a bit low. The main white cell or immune cell that we look at is the neutrophils. So you may hear that you are neutropenic, which just means that your immune system's a little bit low. Now, this doesn't occur with every chemotherapy, but can be a common side effect. So it means that if you got a small cut on your arm, you'd be more at risk of maybe getting an infection, but it also means you're more at risk of getting food poisoning as well. So we do a lot of education with patients about making sure that they've got good hygiene when they're preparing or eating food. So making sure you're washing your hands, which I'm sure everyone's really good at the moment with COVID. Washing and drying your fruits and vegetables well, and reducing the amount of time food is in the danger zone. So you can see on the slide that between 5 degrees and 60 degrees, that's where bacteria will grow the quickest. So when we cook food, we cook it hotter and above 60 degrees, and food's stored, your fridge should be below 5 degrees, so it's stored out of that danger zone. So that just slows down the bacterial growth when things are in the fridge. And when you're cooking at above 60, you're killing off any of the bacteria there. So hence the second point, making sure you're cooking your food really well, particularly meat, fish, eggs, because they're some of the higher risk foods. So making sure you're storing your food safely so that it's, you know, in an airtight container, in the fridge, things aren't sitting out on the bench for too long. And then avoiding high-risk foods. So this is quite commonly known as, I guess, a pregnancy type diet, which women follow while they're pregnant. So those high-risk foods of soft cheeses, blue vein cheese, rock melons, anything with probiotics in them are generally best to be avoided. Anything that's kind of prepared by yourself or close family tends to be at a lower risk, because obviously you perform good hygiene, whereas things that are purchased outside the home are always going to be a bit of a higher risk, because you don't know who's prepared it, when they prepared it, how clean they were, how it was stored, and all those factors involved. So it doesn't usually occur straight away from the first dose of chemotherapy. It usually occurs about 7 to 14 days post chemo. And it generally in chemotherapy, it doesn't stay low for too long. It does bounce back fairly quickly, but it's still a good important point to understand. Some other side effects I don't have separate slides on, but just to mention are mouth ulcers, also known as mucositis. So we generally recommend softer foods that can help prevent any irritation or further damage to the mouth, as well as fatigue, which can be from the chemo itself, because your body's working a bit harder, or it could be because you have a reduced intake as side effects from the chemotherapy, because we obviously get all our energy from food, and if we're not eating as much, then our body's not going to have as much spare to do things that we might like to do, other than our body just functioning for survival. Okay, pass you over to Celeste.
Hello, everybody. So I'll be, I guess, touching on a little bit about the side effects of if you are to have surgery. Okay, so I guess the type of surgical procedure you will receive will be dependent on the stage of your cancer. So one of the surgeries called transurethral resection of bladder tumor, or TURBT, may be used to determine if you have bladder cancer and whether or not the cancer has invaded into the muscle, the bladder muscle layer. It's also commonly used to treat any early stage or non-muscle invasive tumors. If your cancer is a bit more invasive, your surgeon may recommend either a radical cystectomy, so where your whole bladder is removed, or a partial cystectomy. These surgeries can either be done as an open surgery, so where a long incision is made in your abdomen, or keyhole surgery, where a series of smaller incisions are made and the surgeon uses robotic arms or surgical instruments with a small video camera to do the surgery. Before your surgery, your surgeon might ask you to stop eating for at least 6 hours prior. It's very important that you do fast for the recommended amount of time, just to prevent any nausea and prevent any food and liquids from entering your lungs during the surgery. You can usually drink clear fluids up to 2 hours prior to surgery. So these are the fluids that they don't have, I guess, bits in it, or are what we call like kind of transparent. Okay, so things like juices, broths, they should be okay 2 hours prior to your surgery. And this may also include certain nutrition supplements as well, just to help optimize your nutritional status, which I'll later cover in this presentation. If you are to have open surgery, it is expected that you will be in hospital for about a week or two. And so from a nutrition perspective, it's important that you do eat well prior to and post-surgery, especially of calorie and protein dense foods, just to assist with adequate wound healing. Your dietitian might also prescribe some oral nutrition supplements post-surgery as well if you're struggling to eat adequately. And please note that any intentional weight loss is usually not recommended during your cancer treatment. Just a consideration for anyone who does have diabetes, it's important that in the lead up to your surgery that your blood sugar levels are well controlled, because high blood sugar levels can negatively impact your wound healing. I'm going to talk a little bit about nutrition support now. So, and as mentioned previously, during treatment, whether you're getting surgery or chemo or immunotherapy, post-treatment for healing and recovery, your body will need that extra nutrition. So in order to meet your body's increased requirements, you may be recommended to follow a short-term, high-energy, high-protein diet. Okay, and this diet encourages you to eat frequent meals, so aiming for 5 to 6 meals a day, making sure that you're including high-protein foods such as meat and fish, eggs, legumes, dairy, and fortifying these foods as well, so adding extra calories to your food, so adding things like avocado, nuts, seeds, and oils. In addition to this high energy, high protein diet, you might also benefit from consuming supplements as well. In the cases where you're not able to meet your nutrition requirements orally, you may be recommended to have something called enteral nutrition or total parenteral nutrition, or TPN. So in terms of oral nutrition supplements, so they're just the ones on the more left-hand side of the slide. They're a combination of ready-to-drink liquids, custards or puddings or powders that provide extra calories, protein, fat, and vitamins and minerals. They can be consumed just how it is, or they can even be added to foods. So for example, If you see on the slide, there's a picture of the sustagen powder. That can sometimes be added to things like soups or milkshakes or even porridge. Some of these supplements can be purchased over the counter at your chemist, but a majority are specifically prescribed by your dietitian. The role of supplements is to complement your nutritional intake. So as the nutritional profile of different supplements may vary, not all supplements are what we call nutritionally complete. So they cannot be used as the sole source of nutrition. So it's really important that if you are taking any of these supplements, that you do notify your dietitian. And if your dietitian does recommend any of these supplements, that you adhere to their recommendations so that your intake is nutritionally adequate. On the right-hand side are 2 bottles that are examples of enteral nutrition formulas. Okay, so enteral nutrition may be indicated if you're not able to take nutrition orally or at sufficient levels, but your gut is still functioning. So enteral feeding is feeding straight into your gastrointestinal tract via a tube. The common route of feeding is called nasogastric feeding, where the tube is inserted by the nostril and then the tip of the tube ends up in your stomach. The feeding that is used in enteral feeding can only be prescribed by your dietitian and in some cases by a medical professional. Similar to oral nutrition supplements, they come in different volumes and concentrations. So depending on what your nutritional requirements are, your dietitian will provide you with a feeding plan based on their chosen feeding formula. I'm also going to touch briefly on TPN as well, so total parenteral nutrition. So this type of nutrition or type of feeding bypasses the gastrointestinal tract. Nutrition formula is given intravenously, so through the vein and into the bloodstream, and it's used to provide the patient's complete nutritional requirements. It's quite an invasive and an expensive measure, so it's only really indicated if the patient's gut is not functioning due to an ileus, so an obstruction in the ileum, which is part of your small intestine, which the food cannot move through the intestines properly. And if there's an expected delayed recovery of more than 7 days. It may also be indicated if the patient is unable to meet their nutritional requirements orally or enterally, maybe because of side effects or tolerance issues. Okay. In terms of how long you'll be expected to have TPN will really vary between patients. So TPN will generally be weaned when you start passing wind or having bowel motions, okay, because this indicates that the bowel is starting to work again and oral intake can be slowly reintroduced. So I've just got a picture or 2 pictures on what TPN kind of looks like. So the first image shows like a catheter, so a small tube being placed in one of this gentleman's main blood vessels, so the subclavian vein, and the tip of the tube goes into the superior vena cava, which is in the heart, where there's that access to provide nutrition through the bloodstream. And then in the second picture is just what a TPN bag looks like. So as you can see, it's in different compartments. So the different compartments would have like glucose and amino acids and lipids and some of your electrolytes as well. When the patient's ready to start TPN, these compartment seals will be broken and the mixture will be mixed together and then fed through the catheter. I might pass back to Alana. We're going to just go through a couple of myths.
So I think Peter touched on this a bit earlier. So it's quite common that people think supplements, being tablets, capsules, are beneficial in preventing and or treating cancer. So this is not true. There's no evidence to suggest that there's benefits from supplements to reduce your risk of cancer. The main reason that supplements aren't beneficial is because it's unclear exactly what part of a healthy diet has anti-cancer effects. And these nutrients are differently from food than they do in form because they're on their own. For bladder cancer specifically, there's not been shown to be any effect of supplementation from any common vitamins or minerals. And regardless of what type of cancer, or even whether you have cancer or not. Supplements are only considered to be useful if you've been diagnosed with a specific nutrient deficiency. So any supplements, complementary or alternative medicines, therapies, you should always discuss these with your doctor before commencing, because they can interact with conventional treatment or medications that you may be on. So this is one that I hear almost every day. Cutting out sugar will starve my cancer. So this one is not true. In short, it can have serious consequences by being overly restrictive. So the picture that's on the slide, I think most of you would agree that they're all very healthy foods, but they're all carbohydrates, which are made up mostly of sugar. So when people talk about sugar, they're often talking about white sugar that you have on your table, that you might add to your tea, lollies, processed foods, cakes, donuts, that type of thing. But most of our food does contain sugar, which is what it ultimately breaks down to in the gut, which is called glucose. So it's our main fuel source for our body, not just cancer cells. So the cancer won't discriminate about where its glucose has come from, and it'll take whatever it can get, it's from lentils or it's from donuts. But what's rarely talked about is that cancer will actually use fat or protein if nothing else is available. So there is no possible way of actually starving your cancer through diet. It's kind of come about because cancer is quite greedy. It grows more quickly than your healthy cells. Therefore, it uses more sugar and more energy than your average cells, which is why it glows on scans and things. And doctors quite often use that to look at malignancies. But I have a good analogy if you're still not on board with what I'm saying. I liken the cancer to a hungry bully on the kids' playground. It goes around stealing the best parts of all the other kids' lunches. So now, if those kids decided not to bring as much lunch or just bring some healthy stuff, the bully'd probably still take their food, leaving not much left over for those kids. So if we take it one step further and say the kids don't bring any lunch to stop that bully taking their lunch, both the bully and the kids starve. So no one wins in the end. So now your body won't actually let this happen. If you do stop eating altogether, your body will break down your fat and muscle stores to create the energy it needs, which the cancer will still take as well. So like I've said, it's pretty impossible to starve your cancer. Cutting out sugar is not going to have any effect on the size of your cancer. It will not make it grow slower. Having excess sugar will not make it grow faster. What you end up doing is you're starving all your other muscles, red blood cells, brain, and every other cell in your body. And the consequence is that this leads to significant weight loss, fatigue, muscle wasting, and deconditioning. It also increases stress because these are quite hard diets to follow. And also that you don't have as much enjoyment around food, which is a huge part of eating as well, beyond just nutrition, which isn't good for your physical or your mental health as well, which is particularly while you're going through treatment, you've got enough to worry about that you don't need to be worried about being overly restrictive with your diet. So for overall health and general diet, reducing the added sugars can be beneficial, but particularly if you're above a healthy weight range. However, the idea of cutting out sugar completely out of your diet is unrealistic and very oversimplified message for the cancer and sugar debacle, I will call it.
So I'll cover another myth that's also quite common as well. So using artificial sweeteners will cause cancer. So This misconception pretty much stemmed from a study on lab rats back in the 1970s, where the artificial sweetener saccharin, marketed under the name Sweet and Low, was linked with the development of bladder cancer in male rats. However, further studies have examined how saccharin works and is digested in the body, and this indicated that it only occurs in rats. Regarding saccharin and bladder cancer risk. As for other artificial sweeteners, so things like Equal and Splenda also show no consistent association to cancer risk. Because artificial sweeteners are so much sweeter than normal sugar, so anywhere between 200 to 20,000 times sweeter, as humans, we're not consuming it at the amounts where it would be toxic to us. Artificial sweeteners actually might be even beneficial for some patient groups, such as diabetics, that can help assist with their blood sugar level control, because it's not as readily absorbed in the body, which could, I guess with diabetics, like I mentioned before, if they do have high blood sugar levels, can affect their wound healing post-surgery. And patients who are overweight or obese, so wanting to substitute, for example, sugar sweetened beverages for like diet soft drinks is a good way to reduce their total calorie intake and help them reduce weight, and which in turn can help reduce their risk of developing cancer. And then another myth, also quite common, is around eating organic food will help reduce my cancer risk. So as Peter had mentioned before, there are some links to certain chemicals that can increase bladder cancer risk. So like the arsenic in drinking water, but fortunately it's quite well regulated. So that's usually not an issue. But also there is strong evidence that occupational exposure to certain chemicals such as aromatic amines and polyaromatic hydrocarbons have been linked to bladder cancer. So particularly for individuals who work in mechanics and in electronic component manufacturing, they're most at risk. So I guess with that in mind, it's very understandable that whether eating organic food can help reduce the risk of cancer. Because I guess with organic food, you don't have those pesticides and those fertilizers. But in Australia, our food regulator of the SANS, the organisation, only allows a very small amount of pesticide and fertilizer to be used. So because it's used in such a small amount, it's not considered a cancer risk. There was and again, there's currently no evidence that organic fruit and vegetables also have higher cancer-fighting nutrients than your conventional fruits and vegetables as well. There was a large study that was done in France back in 2018 that did question around 69,000 people on their consumption of organic food and followed them up for 5 years to see how many of them developed cancer. The study did find that individuals who reported that they ate the most organic food had around a 24% reduced risk of cancer versus those who had the least. However, the study did not prove that organic food was the direct cause of reduced cancer risk. And the study also noted that the people who did report that they ate the most organic food also had healthier lifestyles as well. So they did more physical activity, they ate more fruits and vegetables in general. So I guess the take-home message in terms of organic food and cancer is should really just be focusing on eating your 2 serves of fruit a day and 5 serves of vegetables a day, regardless of whether it be organic or non-organic food, or non-organic sources, because I guess cost is also a consideration as well. So if any of you in the audience have purchased organic food before, you know that it is quite significant. Most of the time it's significantly more expensive than the non-organic product. So just to finish off, just some take-home messages from our presentation today. Maintaining weight within a healthy weight range has been shown to reduce your cancer risk to begin with. Making sure that you're having a well-balanced diet. So from all your core food groups, so things like your whole grains, your fruit, vegetables, lean meat, and also dairy as well. Engage in an active lifestyle, stay away from fad diets, And if you do need any dietary advice, seeking individual advice from an accredited practicing dietitian or an APD. We've also got some kind of resources from some reputable organisations if anyone else in the audience wants a bit more information. So Cancer Council Australia has some good information around the different types of cancers, the types of treatments, side effects, etc. The Beat Bladder Cancer Australia website as well. When it comes to food, the Australian Guide to Healthy Eating, Peter had mentioned, and then all the information about chemotherapy, immunotherapy that Alana spoke to you about, you can find on EviQ.